Great. Thank you. And I have copies with my contact information. I'm assuming we're good? Okay. First, I want to, my name is Melissa Ann Cunningham Sariq. I'm a lifelong South Carolinian resident of Spartanburg, South Carolina. And before I even get to my testimony, I am infuriated after doing this for years after years after years of hearing lies, even from the lieutenant governor who's sitting behind me, about misrepresentation of people dealing with the aftermath when it comes to depression and mental health from abortion. I will actually be sending y'all, I usually bring copies of that data. I will be sending y'all the data in email about how actually if avoiding mental distress and depression is your motive, that actually having a baby and giving birth makes you 7 times more likely to be dealing with depression and what's called baby blues. So actually, if avoiding depression and mental distress is your motive, and abortion is actually a better alternative. So I'll start. So my name is Melissa Ann Cunningham Sariq, and I strongly oppose S1. I'm here today testifying against medical advice for fear of stress on my heart. Almost 6 weeks into recovery from a terrifying fight with COVID, I'm immunocompromised. I have lost count of how many years I've personally testified against bills like this, and I can tell you that people like me, we really do strive to provide and prepare endearing and compassionate testimonies in the great hope that we do not somehow piss off the proponents of this bill, and I'm too exhausted, sick, and tired to frickin' do it again. I decided I would just let y'all choose which deeply personal and emotional story that are available from years of me doing this and so many other people like me in the legislative video archives, particularly how I would not have been born if it weren't for an abortion, how my health history makes pregnancy a death sentence for me, and how abortion has been a life-saving measure for me. I realize that actually I have failed. I've failed y'all as our legislators. I realize these stories do not provide a relatable scenario at all to this all-male committee. So with the help of my degree in kinesiology from the good old University of South Carolina, I am going to give you the most anatomically accurate and medically accurate description I can. Unlike anything you see on TV with an external ultrasound wand, a transvaginal ultrasound wand is used to detect the heartbeat, or at least heartbeat for at least the first 12 weeks of pregnancy, and that is while the woman is lying in what's called the dorsal lithotomy position. So I'm actually inviting you, and so we're going to learn today some things. I actually have one here. This is it. And so I'm actually inviting you, if y'all would like, to even put your feet up on your desk and experience the lithotomy position. This is what you see when you see a woman, on TV with her feet in the stirrups. And I'm sorry, if y'all think this is inappropriate, guess what? So is this bill. However, I don't want y'all doing anything with your body, and I would never ask you to do anything with your body that you don't want to do. So this is a wand that is actually, and actually I'm the exact height and weight, 5'9", 190. I'm a big girl. Actually, thanks to COVID, I'm probably pushing 195. But the actual height and weight of the American male in this probe is actually 20 centimeters, and it's almost the exact length of my ulna, okay? And I'm actually, if you want, you can actually pass this around. It's show and tell. I want you to know what you're doing. I have no problem letting somebody see this and hold this for a few minutes. So basically, I'm going to assume we also both have a rectum, that none of y'all have vaginas. And the most reliable way I can compare is this bill equates to requiring the insertion of a probe the length of your forearm into your rectum or body cavity, regardless of consent. This bill is actually legalized rape as defined by the U.S. Department of Justice. I have copies of that as well. And the truth is, I'm staring at, and I will wrap up, the state motto in front of me, which is Dom Spiro Spero. And I find it ironic that our motto is, while I breathe, I hope. And we're sitting here discussing this while even myself and so many other people, thanks to the pandemic, are struggling to breathe and quickly losing hope. Thank you.
Thank you. Questions by members of the subcommittee?
Hi, Representative Bamber.
Hello. Thank you for that. And I know I appreciate you trying to get through as quick as possible. The instrument that you held up,
yes.
Okay. A big part of the bill is ultrasounds. And there has been discussion year after year with regards to this. Last year was 30/20 about which ultrasound method is the best for detecting a fetal heartbeat or anomaly, whatever the case may be. What you have there, is it my understanding that in order, if a physician were using that to comply with this bill, that doesn't go on the outside.
Correct.
Right? That's inserted into.
I'm sorry.
that's inserted into the woman?
And I even have, Dr. Bingham and I are good friends, and I will tell you, this is actually what is, there's flesh. In my case, there's a lot. And so in order to even hear, and this is something, I was trained in cardiac rehab at Richland, and so I understand how hard it is to even, hear things through a stethoscope. And so, yes, in order to best identify this, and actually when I procured an abortion, basically in the first 12 weeks at a minimum, this is what's used. When you watch even like Friends, when Rachel was getting hers, it's on the outside.
And that was just for clarification for the committee or anyone watching who is unsure, because I think,
Thank you.
Unfortunately, people who think ultrasounds instantaneously revert to the stereotypical, I'm holding this and putting the gel down and, and that, but that's not the case. As far as what is the most accurate and what is going to be used and be
What
forced.
is the only way, sir?
The only way.
The only way in the first trimester.
Will be for physicians to,
Insert this.
per statute, they're forced to insert that into a woman. Okay,
Yes.
thank you.
Sorry, thank you.
Other questions?